Welcome back to the channel. I'm Kevin and this video is the fourth part of our 5-part series on all things GTPS. So far we've talked about the risk factors for GPS, the assessment, as well as treatment including patient education and treatment adjuncts, and today we're diving into the imaging. In this video we're focusing on exactly what to look for when assessing GTPS on X-rays and on MRIs. We'll identify the changes to the Greater Trochanter that can be associated with GTPS on X-ray, as well as understanding the different MRI slices available, and learn to identify all the most common pathologies, including Gluteal Tendinopathy, Min and Med, Gluteal tendon tears, Min and Med, and Trochanteric bursitis. So let's jump in. So while MRI is gold standard for GTPS, X-rays do have their place. So we can see here, this is a normal regular surface of the Greater Trochanter, but comparing it to B, you can see a irregular surface on the Greater Trochanter with small peripheral osteophytes, which sometimes can suggest long-term abnormal load or tension where the tendons attach. On here, on the final image, the orange arrows point to the calcifications extending to from the Greater Trochanter. You can also see the superior blue arrows indicating the gluteus medius origin, and the dotted pink arrows pointing to the gluteal tendons that attach to the superior facet of the Greater Trochanter. We can also look here at different slices. So the first image on the left is a sagittal slice. This is splitting the body into left and right, providing us with a side-on or lateral view of the lateral hip. The coronal or frontal plane splits the body into front and back parts, and this is providing us with an AP view. Whereas the final slide is a transverse or axial slide, which splits the body into a upper and lower part, and this image shows the hips looking from above. Now, this slide is our normal hip anatomy. So we can see here, you've got this is an axial view here, and we have the posterior facet at the back where glute med attaches. We've got the anterior facet where glute min attaches. We've also got, you can see here on the a wider view, we've got the glute max, glute min, glute med. And on this axial slice here, you can see, again, this is where the actual structure is attached to the lateral hip. This slide is a nice sagittal view, so we can see here that we've got the glute min tendon attaching to the anterior facet, and we've got the glute med tendon attaching to the posterior facet. The coronal slices or frontal plane slices, you can see here, so this is going from front to back, so you can see the glute min, and then as it goes further back, so now this side is looking at the hip from the back, you can actually see the glute med tend quite nicely. And this is an AP from the front, which again, you can see the glute med and min tendons coming down quite nicely, and the ITB as well. So GTPS is an umbrella term encompassing multiple conditions, including trochanteric bursitis, gluteal minimus and medius tendinopathies, and gluteal tendon tears, both partial and full. And this brief video will go through what to look for each. So the first part is the actual T1 coronal slice. So you can see here the fluid-filled distended trochanteric bursa with inflammation, so we can see the arrows. The middle image is a T2 coronal slice showing trochanteric bursitis, where the arrow is here, and the far right image is a T2 axial slice showing trochanteric bursitis, so you can see that quite clearly. So tendinopathies are demonstrated usually on MRI as increased tendon thickness, signal changes within the tendon, and or swelling in tissues around the tendon. So image A is an axial slice, and you can see the changes and the signal changes at the anterior facet. Image B is a T2 frontal slice, and the increased signal can be seen in the tendon. And the final image C is a sagittal image, T2 slice, showing the increased signal in the glute min tendon. Whereas glute medius tendinopathy, it has the same things to look for, so increased tendon thickness, signal changes, and possible swelling in the surrounding tissues. So on the T2 axial slice here, you can see that thickening associated with tendinopathy at where the glute med insertion. And the T2 coronal side view, you can actually see there the increased signal changes suggesting gluteal medius tendinopathy. The next slide shows a progression. So from tendinopathy, you can then start to develop tears. So the first two images are T2 axial slices. The third image is a T2 coronal, and the final image is a T2 sagittal. And you can see on the first image, a partial tear progressing to a full tear. And same here with the tears. You can see this on the side and on the axial as well. This next slide shows gluteal minimus tears. Now the first two images are axial T2, and you can see the signal changes here. And the next one is a T2 sagittal slice. The white arrows are the glute min, the black arrow is the glute med, and then we've got a frontal T2 slice, and the white arrows show the tendon signal changes in the gluteal minimus. So, following this brief video, the take-home messages, you should be able to identify the signal changes to the greater trochanter that can be associated with GTPS on X-ray. You should be able to understand the different MRI slices available when looking at the lateral hip, as well as identifying gluteal medius tendinopathy and tears on the different MRI slices, and identifying gluteal minimus and gluteal minimus tendinopathy and tear on the other different MRI slices, as well as identifying trochanteric bursitis on the different MRI slices available. I hope you found this video useful, and if you have, please like and subscribe, and I'll see you next time for the last part in the series all about rehab exercises.